Good morning. In this video, I wanted to discuss the review systems. The review systems is a big integral part of your visit. And the way we use the review systems is almost like a screening tool. It's like a radar that you put out there and you look at all the major systems in the body to make sure there's nothing that the patient might be experiencing that would be dangerous and that they might not see it as dangerous. So it gives you an opportunity to look into things, to avoid missing things that might be important and even many times even deadly. The other thing that it does is that it might help you connect, um, or have a better picture of what might be happening based on the the chief complaint that the patient has, or the symptoms or the findings from your history in the HPI. But what it does is that it gives you that sense of completion into all the areas that could be dangerous, and just make sure that you're not missing anything big. So what I'll do is I'll put that LR tele ROS, and what it does is that it brings us the review system, and usually we check 5 of them. And you can check as many as you like, but the truth is that if you go through the 12 of them, it will take you a long time. But the main thing is in a regular visit, when there's no complaint and there's nothing really happening, gives you the checking the 5 of them will just give you a good picture of what's going on. So the first one is the general fever and chills, and you can also have to that fatigue. And with that, you think about infection, you think about lupus, you think about lack of vitamins, and then you ask about cardiac, chest pain, palpitation, swelling of the legs, and that gives you information regarding um, heart attacks or ischemia, also arrhythmias. Edema is very important because it tells you about 4 systems in the body. It tells you about the cardiac. People with CHF would have edema. Many times it will also tell you about the liver. When there are liver issues, you don't produce enough proteins, and that can lead to edema. You could also tell you about kidney when there's kidney problem. Fluid is being accumulated in your body. Also vascular, if there's venous insufficiency, there'll be edema in the legs. And also it can tell you about endocrine hypothyroidism. People can get max edema, and that would happen. The other thing that it would tell you is that if somebody has a cancer that is blocking the lymphatic system, it could show up as edema in the leg. So just looking for edema is a very important question to ask. And what are the interventions? If somebody has palpitation, you can order an event monitor, make sure you're not missing any arrhythmias. If somebody has edema, you can order an echo. If somebody has chest pain, certainly refer to the cardiologist, especially if it's a diabetic who tells you, oh, have this vague sensation in the chest. It might not be chest pain, but it might be just a vague sensation. That is enough. Any diabetic, you want to make sure you don't miss anything with the heart. Also, you ask about respiratory, wheezing, coughing, and shortness of breath. Same thing, with wheezing, coughing, and shortness of breath. That could be asthma, that could be pneumonia, that could be also a COPD if they're smokers, that could be CHF if they have hypertension and no history of an echo. That might be the symptoms that are showing up. Shortness of breath especially is very subtle, and smokers, as they start developing COPD, they start having shortness of breath. If somebody's starting to have congestive heart failure, they have shortness of breath. If it is sudden shortness of breath, then you worry about pulmonary embolism. Then you ask about nausea, vomiting, diarrhea. That could give you clues into a viral infection. It could give you clues into diabetic gastroparesis. Also, if you have diarrhea with blood, that could be Crohn's disease, that could be colitis, new diarrhea that looks different. You worry about any obstruction, and then you worry about cancer with that. So with the nausea, you I think about H. pylori. I noticed that that's one of the symptoms that happen a lot when people have nausea. And then you ask about dysuria and frequency. Dysuria, of course, you think about UTIs. With the frequency, you think also about UTI, but any male with frequency, you worry about prostate cancer. So the way you would ask the question is, no, do you have any fever, chills? Do you have any chest pain, palpitation, edema, any wheezing, coughing, shortness of breath, every nausea, vomiting, diarrhea, any dysuria, frequency, burning when you pee? So as you can see, this questionnaire, which is 5 systems, it lasts about a few seconds, but any positive that comes out of that, it can lead you to inquire about other dangerous situations that could be happening to the patient. So you always want to have a good ROS. 5 systems is good for me, but if you want to add neuro, tingling, numbness, headache, dizziness, those are other symptoms that can lead you to look into situations